Welcome everyone to this online Vax Chat. My name is Debbie Wood and I'm the Acting CEO at the City of Whittlesea. Before we start, on behalf of the City of Whittlesea, I'd like to recognise the rich Aboriginal heritage of this country and acknowledge the Wurundjeri Willam clan as the traditional owners of this place. Thank you to everyone who has taken the time tonight to join us in the Vax Chat, where we will specifically discuss the COVID-19 vaccine for children aged 5 to 11 years old. We're delighted to have with us tonight Dr. David Tran, Clinical Director of Paediatrics at Northern Health and Clinical Lecturer at the University of Melbourne, who will be presenting some information for you tonight about the children's vaccine. Thank you very much for joining us tonight, David. Here in the City of Whittlesea, nearly 93% of people aged 15 years and over have received 2 doses of the vaccine. And from last week, children aged 5 to 11 are now also eligible to receive the vaccine. And already across the state, over 17% of Victorian kids in that age group have had their first dose. With high rates of infection across the state at the moment, and with schools starting pretty soon, vaccinating this younger age group is an important measure to helping to protect our community. So this session is designed to give our community the information you need to make an informed decision about the vaccine for your child or children, and to feel confident to book in to have vaccine if you haven't already done so. Tonight, we will begin with a short presentation from Dr. Tran, and then we will dedicate the rest of the time to answering the questions that you may have. So to ask a question, we will be using an online platform called Menti. So we will need you to have a device with a web browser on it if you've got one available. All you need to do is to log into menti.com. It will ask you for a code. Please enter the code, which is 23597077. Or alternatively, if you have a smartphone available, you can scan the QR code on screen to get to the page. So the code for this session is 23597077. You can submit your questions at any time throughout the presentation, and we will run through them following Dr. Tran's presentation. I will run through these instructions again following the presentation, just in case you didn't get all of that information then. We really hope that you find this presentation informative and valuable. We will also be recording this session for those who can't make it, and it will be publicly available on our website. So please feel free to share it with other family or friends who may also find it beneficial and may not be able to be here tonight. So without further ado, I will now hand over to Dr. David Tran.
Thanks very much, Debbie, and it's a real pleasure to be able to present to everyone tonight. And I'd like to thank the team from Whittlesea Council and obviously the team from Northern Health as well. So tonight I've got the pleasure of talking about the COVID-19 vaccination kids, and as Debbie mentioned, there's the Menti website and the code. If you have any questions, feel free to post it throughout the presentation. I'd also like to start by acknowledging that I'm presenting this from the lands of the Wurundjeri people, and acknowledge the traditional custodians of the various lands of which other people here might be working from, or Aboriginal and Torres Strait Islanders who people participating in this webinar. The agenda for my presentation tonight would be just to start by talking about some of the COVID-19 local data, particularly in the Whittlesea area, but we'll be focusing a bit about how COVID-19 affects children, and obviously about the rollout of the vaccine now to children aged 5 to 11, particularly or hopefully addressing questions about the recommendations and safety data around it. And there will be plenty of time at the end to also ask questions. So it's been quite an unfortunate start to 2022, obviously, with this huge surge in numbers when we're hoping past the Delta wave that Omicron, no one anticipated Omicron was going to hit when it did, and unfortunately the numbers have really surged. The big group that are being affected at the moment in Victoria here, and as we're seeing across Australia, is certainly the young adult cohort, the 20 to 30 age group, but particularly this is the population that we're worried about, the 0 to 9 and the 10 to 19 group, which are still predominantly unvaccinated compared to the adult population. Here in Whittlesea, our population of just over 230,000 people, there've been 22,000 confirmed cases. This is data from the Victorian website, Department of Health website, taken from yesterday. And there are still about 4,800 confirmed active cases, which gives us a ratio of about 1 in 50 people infected. Next door neighbour in Hume, we're seeing similar numbers. So obviously Hume and Whittlesea are two of the top 5 local government areas in Victoria that have the highest rates of COVID-19, and the other big cohorts are out in the western suburbs. Through Northern Health, we've seen we're supporting a huge population in making sure that they're well and safe at home. And there are daily phone calls through this community pathway where we're checking in and making sure that families are safe with their COVID status. We've got 4 COVID wards open in the hospital with around about 90 COVID positive patients in hospital at the moment. And recently we've had to open up a designated area for women's and children's patients, so pregnant women, newly birthed mothers, and babies and the paediatric and young adolescent children. We were really proud to be part of and setting up the out-of-home care for children with whose parents are too sick with COVID, and that's based at Latrobe, and that's been fortunately not overused because we've been able to keep the numbers under control. So that was just a bit of a plug for the Latrobe Kids in Care, but fortunately we didn't have to use it too much. And part of the reason why we haven't had to use it too much is that COVID infection itself in children has been relatively mild. We do know that children generally suffer very mild illnesses or maybe completely asymptomatic. The symptoms that they do tend to get are fever, mild respiratory symptoms, and sometimes some abdominal pain or gastrointestinal symptoms. Very few children across Australia have required hospitalisations. During the June to October, the Delta outbreak, the hospitalisation rate in Australia was less than 1% of children with COVID needing hospitalisation, and even less, 0.05% needing ICU admission. So very, very few were very unwell with it. There is a small cohort that were identified as high risk of becoming unwell, and those were children with underlying medical conditions, those that were obese, those that had significant congenital heart disease or severe asthma, for example, tended to need higher level of care. But overall, very low numbers. Many young infants or children with COVID were admitted. It's either for other reasons rather than just respiratory support, and that might be for some fluid maintenance, some feeding help support, or for some close monitoring. And we've had the COVID rollout to from 12 to 18 since around about October of last year. And now from the 10th of January, it's now been rolled out to 5 to 11-year-olds. It's gone through a fairly vigorous process through the Therapeutics Goods Administration, and then now ATAGI, which is the medical body recommending for Australia what would be the best recommendations for the children. And they're certainly recommending that the children get 2 doses 8 weeks apart. And that, for those interested, the dose is a third of the dose that's been given to adolescents and adults, so only 10 micrograms. Some of the questions that have come up frequently that we've encountered include if you've had SARS-CoV-2 or COVID infection, can you still receive the vaccine? And the short answer is definitely yes. It's still very uncertain as to how the different strains and the length of period that you're immune to it. And so current recommendations are that as soon as you've recovered from the COVID infection itself, that you'd be eligible for the COVID vaccine. And this would apply for children as well. Children who turn, now there's very sort of distinct timing of the vaccine from 5 to 11. And so to make it clearer, they've said that if you're over 12, you get the 12 and up dose of the 30 micrograms. And if you happen to turn 12 halfway through, or if you've received your first dose and then you turn 12, you then go on to receive your adult or your 30 microgram dose for the subsequent or second dose. And yes, it definitely can be administered with other vaccines, particularly if there's a routine schedule or a catch-up schedule as part of the National Immunisation Program, then we would recommend administering at the same time. The big question of why are we vaccinating children who are 5 to 11, even though the symptoms are quite mild and most recover quite well, is that it is very effective in preventing the illness in the first place. And the evidence or the data is talking about a 90% effective rate. So if you want to stop or prevent your child from getting sick in the first place, it's a very, very effective vaccine. And the other benefits are obviously to stop the spread, particularly with the schools due to restart in the next 2 to 3 weeks. We really don't want further disruptions to their schooling, unnecessary furloughing or having to be in isolation, and certainly wanting to minimise the spread of the infection to vulnerable people. One of the big highlights or big parts of or benefits of preventing the infection in the first place is preventing the complication of COVID-19 from what we call PIMSTS. And this is quite a unique phenomenon to COVID. PIMSTS stands short for Paediatric Inflammatory Multi-System Syndrome, temporarily associated with SARS-CoV-2. So it's a very long name, hence why PIMSTS has been the mnemonic. And it's really a post-inflammatory. You get this, your immune system mounts this response after the infection, often about 2 to 6 weeks after catching COVID. And around about 1 in 3,000 children get it. And it seems to be the immune system can mount such a significant response that it can be life-threatening. And it can certainly affect their heart and they have ongoing cardiac complications. At the Northern Our experience so far, we've had 2 cases of children needing to be transferred to intensive care with PIMSTS, and they needed quite potent anti-inflammatory medications and are going to need quite intensive monitoring ongoing. Regarding the side effects of the COVID-19 vaccine, so they are very mild and not too dissimilar to many of the other standard vaccines. So you get a sore arm, you might get a headache, you might get be a bit tired or fatigued afterwards. Most of these symptoms are managed with simple pain relief, Panadol or Nurofen, and certainly don't seem to last very long, a day or 2, and their symptoms seem to recover. Majority of children and majority of patients don't need medical care for these side effects. The trials that have been done so far showed very very few adverse side effects and very, very few serious side effects. And probably what's more impressive is the real world data that we're getting since we are rolling it out about 3 months after the Northern Hemisphere. So the US, Canada, European Union countries have rolled out the COVID vaccine in children 5 to 11, and they're seeing very low rates of side effects. And you can see there quotes of 0.05%, so incredibly low. One of the concerns in the older adolescent cohort was of a condition called myocarditis that seemed to be after the Pfizer COVID vaccine. We're not seeing that at all in the young cohort, in the 5 to 11 age group at all. So it is a real strong recommendation that there is significant benefit in having your child vaccinated, and very low side effect profile at all. So how do you get your children vaccinated? It's a centralised booking service. Unfortunately, there won't be a walk-in centre for a 5 to 11 cohort. The 12-year-olds and up do often, there are walk-in services available, but from 5 to 11 age group, you will need to log on to that website there or call the coronavirus hotline on the 1-800 number to book in an appointment slot. And there's still quite a lot of availability around the place. Lots of families are trying to get in early. I've been really ecstatic to see that the uptake already is around about that 15 to 20%. So it's fantastic. And we really want to get it as high as possible, especially with the schools opening up. There are plans to actually have schools be a vaccine centre starting in mid-February, and I've listed some of the schools that have been so far highlighted down below on that slide there. Northern Health has been involved through the centre at the Plenty Ranges Arts and Convention Centre in South Morang, the PRAC centre there. And as of 2 days ago, I think on the 18th, we had over 500 adults and 200 paediatric patients having their COVID vaccine, which is fantastic. And something I'm really excited about is that we've joined with VIXIS, which is the Victorian Specialist Immunisation Service, to provide vaccination for children with disabilities and who are incredibly anxious or needle phobic, to provide a sedation service for them to receive their COVID vaccine as well. And that's ramping up even more in the coming weeks and months. To access that, you have a chat to your GP and they can make a referral to this Victorian or VIXIS service that's online there. So just to summarise, the Pfizer COVID-19 vaccine is now available for children aged 5 to 11. There's really good evidence to suggest that the vaccine is very, very effective in preventing the illness, preventing the complications of the illness, that it is very safe, and the side effects are very mild. And we are recommending as 2 doses that are 8 weeks apart. And we'll open up to questions. And before I forget, I just wanted to show you my slides of my 2 of my 3 children. The story behind this very quickly: Hugo, he's 6, he received his vaccine recently. He was more upset that his 4-year-old brother got a lollipop rather than being upset from the vaccine itself. So it's actually went through very seamlessly and smoothly. You can see the link up there to the Menti website and the access code to put in your questions. And I believe we'll be putting up the actual QR codes shortly so that we can you can post questions and we'll be available to answer them.
Thanks, David. Thanks for that really detailed and informative presentation. It was great just to see all of that information there that you shared with us, so thank you. And David did mention it, and I'll just mention it again if you do want to. We do have a lot of questions coming in already, but just if you do want to go to menti.com, the code is 23597077. Might jump into the questions now, David. So first question we have is, when do you think we will know the long-term side effects of COVID-19 in children?
Yeah, it's a really good question. I mean, we're getting lots of real-world data from around the world about the long-term side effects of COVID. Fortunately, what we're seeing so far is that we're not getting any of the long COVID illnesses that we do seem to get in adults, where they get these prolonged or protracted symptoms over weeks and months. The vast majority of children, all the children that we're seeing at the moment, is their symptoms seem to be very mild and very short lasting. I guess that's the best I've, yeah.
That's good, thank you. I have another one. So if my child has had COVID, do I have to vaccinate them, or do they have better immunity from having the virus?
Yeah, again, excellent question. It's something that's been raised multiple times. With the differing strains of COVID that we're seeing, Delta and Omicron, there's a lot of uncertainty as to how long our immune system is providing immunity for. And especially when there are peaks, like we're seeing at the moment, we are seeing that having your child vaccinated is certainly providing benefit over just getting COVID by itself. So we are absolutely recommending to get the vaccine, even if you've had COVID itself.
Yeah, great. Thanks, David. You spoke about this one a little bit, but so what supports are in place for children with heightened anxiety and stress? And I've actually got 2 grandchildren and took them to their vaccination centre, and there were certainly some children there that I could tell had a bit of anxiety, but it was a great setup. I would have to say it was a really good setup for the children, but yeah, any thoughts on that one?
Yeah, so I actually, the experience that we've had so far is actually the 12 to 18 cohort have been probably a lot more challenging than the 5 to 11. The 5 to 11, I think they're so used to having your national immunisation schedule, your routine schedule, and they're pretty tough kids, and they roll up their arm and get it done. There are a few avenues of getting support for anxious, needle-phobic children. There's the really good government website. The Victorian government, Australian government have come out with a whole plethora of videos on YouTube about what it means to have the vaccine, and to try and really just to ease their concerns about it. A lot of centres are actually set up specifically for children to be vaccinated, and we can talk about the PRAC centre there in South Morang. They've got a separate designated area for the children to be vaccinated. It's actually quite child friendly, and for those kids who are needing a lot more support, there's the Whittlesea centre there. It's a centralised Victorian-wide service where your health professional, your GP, for example, will make that referral there. They'll allocate it to, for example, the Northern Hospital, who will then contact you and organise for that to be done after some consultation with the parents.
Great,
yeah.
Thanks. And yeah, no, and it was a PRAC centre that I went to, David, and they've got a big tree on the wall, and they get a leaf to put their name on. And one of the children had their eye on where they wanted to put the leaf, and that was all they were worried about. He just wanted to get his leaf in that spot.
Yeah,
so it is set up really well.
Yeah, that's right. And they've actually got a lot of distraction technique there at some of the centres. You know, video, virtual reality goggles, music, and iPads.
Yeah.
You know, all those things that really help children get through that.
Yeah, absolutely. So, David, why hasn't WHO endorsed the vaccine for 5 to 11-year-olds?
Yeah, again, a really good question, and I think it's where we're looking at is our local caring for our local community and caring for our local families and children. I guess the World Health Organization do have differing priorities, don't they? They have to look after all countries and all backgrounds. So they certainly haven't discouraged it, but their priorities is trying to vaccinate less advantaged countries and less advantaged areas. They've certainly acknowledged the benefits of the vaccine in young children, but that's probably not their priority compared to other countries who don't have the vaccine at all. So most of our recommendations are driven by ATAGI, which is the Australian Technical Advisory Group on Immunisation. It's a medical body focusing on the healthcare of the Australian population. So that's where we're getting our advice from.
Yeah, great. Thanks, David. And again, you touched on this a little bit in your presentation, but maybe you could just expand on the importance or why do we need to get young kids vaccinated if they don't get very sick from COVID?
So there's probably we can sort of split it up into three broad categories. One is it's still an illness that can cause disease, and it can cause illness. Even though the vast majority of children are fine with it, there is still that small population that do become very sick from it. The vaccine is 90% effective in preventing COVID. The second thing is preventing the complications from COVID. And one of the big complications we talked about was PIMSTS, which can be life-threatening. And the third reason would be preventing the spread of this virus to those who are more vulnerable, who either can't get vaccinated or who are quite immunosuppressed. And so that's the other big bonus as well. Yeah,
great. Thanks, David. And you just mentioned that the vaccine's 90% effective for children. So if the vaccine's 90% effective for children, does that mean only 10% of vaccinated are catching COVID?
No, unfortunately, it doesn't work that way. I mean, there's a lot of reasons why. It's not that you can't get COVID, but the symptoms, the side effects are very, very mild. But also your immunity wanes, and we're still looking at what the timing and the impact, particularly for children who are immunosuppressed or might not be able to mount as much of an immune response. Whether or not they're more vulnerable at catching COVID, for example.
Yeah.
So no vaccine is 100% perfect, but it's certainly very, very effective.
Yeah. Okay. Thanks. What is your advice if there are unknown allergies currently being investigated in children? And as a parent, obviously that's quite scary. So what's your advice on that?
So regarding allergies and the vaccine, for example, so this is actually quite a interest of mine. I have a particular interest in allergy, and I'm part of the allergy department at the Children's Hospital. We know that the ingredients in the vaccine are not in the past, we were used to be concerned of things like people who had egg allergies or certain allergies like that, which is not the case anymore for these vaccines. It's certainly not relevant at all. The only allergenic ingredient in the vaccine that's been identified is something called PEG, or short for PEG. And in actual fact, a lot of people have had PEG is used in a lot of products, and most people have been exposed to it without realizing it. So it's actually very rare to be allergic to it at all. So the actual rates of allergy or anaphylaxis to the vaccine is incredibly small.
Yeah. Okay, great. Thank you. We've seen a number of variants now. We've seen Delta, Alpha, and now the new one. So will new variants impact the vaccine's effectiveness?
Oh, it's a big unknown, isn't it? And I guess the science behind it would be that the core part or core component of the COVID SARS-CoV-2 vaccine, SARS-CoV-2 virus itself, is still what your body is mounting immune response to. So even though there might be some variants to it, the theory and the hypothesis and what we're seeing is that it's still very effective. How effective it will vary, no doubt, but so will the immunogenicity and the type and virulence of the virus itself. So, wish we had a crystal ball about, will it be effective in all COVID strains? But that's what we've got at the moment.
Yeah. A crystal ball would be helpful in a lot of these situations, I think, Dave, but thank you for that. So when will the Moderna mRNA vaccine be available for children aged 5 to 11?
Yeah, that's a really good question. So I know that there are trials going on at the moment, and it's probably just a matter of time. There's certainly studies occurring overseas, and so I don't expect it to be too far away. Yeah,
great, thank you. I think this next question is really relevant at the moment with the large numbers that we're getting of infections. So how long should we wait for the child vax if my child is still recovering from the COVID infection?
Yeah, so as soon as your child is recovered is at the moment the recommendations, and the recovery, fortunately for most children, it is not a prolonged period, and so as soon as their fever is resolved and their appetite's back to normal, and they're behaving back to their normal state, then absolutely book them in. It has to be outside of their, I should say, it has to be outside of their 7-day isolation period. That would be the standard with any of the vaccines at the moment.
Yeah, great, thank you. I think that's just, hold on, sorry, I had that one. When is ATAGI anticipated to announce vaccinations for under 5-year-olds? Are there any clinical trials currently underway?
Yeah, absolutely. So the original clinical trial that Pfizer did for children actually is from 6 months and above. So, and there's really good data already to show that it's very effective and safe in 6 months to 5 years. There's still a bit more work and recruitment to occur to increase their numbers to power it effectively. So I suspect that will be on the cards as well, but as to when, I'm not sure. There's certainly a good suggestion that it will be in the near future as well.
Great, thanks, David. Can an adult take a paediatric dosage?
Well, hypothetically, I mean, from a safety and then absolutely yes, but the effectiveness is just not going to be there. Certainly, it won't be anywhere near as effective as the adult dose. It is 1/3 the dose of an adult dose, and so we would follow what the evidence and the trials were based on those dosages.
Yeah. Thank you. Next one. So, if the vaccine stops the spread of COVID, why do we have so many cases of COVID currently?
So I guess, like we're saying, it's not 100% effective. There's still 10%. And, we still have a large portion of the population that's not vaccinated, which is the young children. So they're still getting infected, and it's being infected amongst the family. So it's not to say that you can't get COVID if you're vaccinated. You certainly still can, but your recovery is faster, your risk of spreading it is faster, and certainly your risk of complications is much lower. Yeah, great. I'll
just keep reminding people, if you want to put questions in, just to go to www.menti.com and use the code 23597077. David's here to answer all of your questions. So David, one more question. When should immunocompromised children be taking their 3rd dose for their primary course?
Yeah, that's a great question. So children who are immunocompromised, like you said, their primary course is 3 doses, as opposed to our recommended 2 doses for the rest of the population. I actually have to, I might actually defer. Craig, are you online there? For the 5 to 11 cohort, do you actually know on the top of your head when that is? I just want to make sure I've got my numbers correct.
Hi everyone, my name's Craig, one of the infection specialist officers from the Northern. I work really closely with Dave. Yeah, so it's similar to the adults. So it'll be from 2 months after the 2nd dose for immunosuppressed kids.
Thanks, Craig. So 2 months. Thanks, Dave. All right. So Interesting question with mandates. I think a lot of conversations around mandates at the moment as well. So, Dave, do you think it will become compulsory for children between 5 to 12 years of age to be able to attend school and sports?
Yeah, it's quite topical, isn't it? We know that kids have been through a really tough time, and everyone's been through a really tough time over the last 2 years, and kids in particular. Homeschooling was not easy and isn't easy at all. And to add on the pressure of having to mandate a vaccine for this for this 5 to 11 age group is going to be very difficult to enforce, I suspect. Certainly the recommendations from ATAGI and through big paediatric bodies like the Royal Children's Hospital have certainly been encouraging that it not be mandated, that it be strongly recommended. But we do know that there are a lot of very anxious and very stressed young children out there. So it is strongly recommended, but I'm hoping, and I don't think it will be mandated in the 5 to 11 cohort.
Yeah, thanks, David. That's the end of the questions. I'll just give it a minute, see if anyone, another one just came in. So, yeah, interesting question. Will kids need a booster like?
Yeah, the evidence is still, we're waiting for the evidence to come in at the moment about whether kids will need boosters. So they're sort of assessing the immune response in terms of how effective you are in protecting you down the track. And also will depend a bit on the surges and timing of if there's another strain and surge that comes out. At this stage, there isn't a recommendation for young children to get a booster, and so it's only for the 18 and up as a standard. But watch this space. There's evidence coming out all the time that you might see this recommendation change.
Yeah. Is it highly likely that this will become like a flu vaccination that we have every year?
Oh, I don't know. Craig, what are your thoughts about that?
Yeah, look, as you said before, it's a bit too early to tell, isn't it? I certainly think that most of us will be recommended to have probably that 4th dose, and I think that'll be probably with a vaccine that's suited to the variant that's circulating at the time. So a lot of the companies are developing a vaccine for the Omicron variant at the moment. I suspect that might happen again at some stage in the future, but it's too early to tell at the moment. I don't think we're going to be getting annual COVID vaccines forever, but I guess we'll just have to see.
It's a crystal ball answer that David had before, I think. Thank you for that. So this is topical as well with the announcement around Novavax. So do you know, David, if Novavax is going to be approved soon for children?
I'm not aware of any studies or drive for it to be in the young, in the paediatric population. Certainly hasn't been hit my radar at the moment. It's been predominantly the Pfizer going down to 6 months, and then the Moderna down in the younger paediatric population. So not that I'm aware of.
Okay, great. And you've been dealing with this for a little while now, David. So what are the worst symptoms that you've seen in children with COVID?
Oh, goodness. So, I mean, we do get kids who come in with severe respiratory or gastrointestinal symptoms. In the young children, it's predominantly poor feeding, like any other virus. So fevers and poor feeding, so they get dehydrated. So we've had quite a few that coming in that needing just fluid rehydration or monitoring of their feeds. Probably the most tragic ones are the ones that whose parents are too unwell, who've been too unwell. So the kids in the out-of-home care, that's been really difficult. The children have been relatively well, and it's the parents who've been terribly sick. And then probably the other case was the one particular case of a child with PIMSTS who was incredibly unwell with high fevers for about a week or 10 days, and looking like they were getting worse, needing transfer to an intensive care service.
Yeah, yeah. It's sad when you see young ones like that. Will Pfizer be the only vaccine available for kids, or are others likely to be approved also?
So I think the Moderna is probably the other one that I suspect will become available. Probably those two on the horizon. That's on the horizon. I can't think of any others at this stage.
The next question's a similar one, but do you know if children are able to have the AstraZeneca vaccine?
Yeah, I was going to mention AZ.
Yep.
So it hasn't been it hasn't been approved for use in children, and the effectiveness, it is still a very effective vaccine, but not as effective. And so I think most of the evidence and trials would be with the Pfizer one, and if that's available, then that'd be recommended. Certainly in the older adolescent group, those who've had, for example, a reaction or a significant reaction to the Pfizer or Moderna one, then that would be in consideration for the AstraZeneca one, but it'd be a second or third line option. It wouldn't be a first line option.
Yeah, thank you. If a child is receiving chemotherapy, are they able to get vaccinated?
Yeah, absolutely. And if anything, they're probably the ones who are most vulnerable of the disease itself, and so would benefit the most from the vaccine. It's important for them to talk to their healthcare professional about timing of it, and also they'll be needing a third dose as part of their primary dose. But absolutely, the children who are immunocompromised or on immunosuppressant medication or chemotherapy, for example, should definitely have the vaccine.
Yeah. Okay, great. It's very follow-up to one of the answers we had before, but so why is the ATAGI recommendation different to the one from WHO for children under 11? Yeah,
so ATAGI's main focus is looking after the Australian population, whereas World Health Organization, they do have competing, I guess, priorities. They want everyone to at least have had one or two, and particularly the adults and the aged population. So, in a lot of countries who are don't have the vaccine available to them, they're really going to be prioritizing them first. And it's very hard for them to recommend 5 to 11 cohort if the adults aren't yet vaccinated. They've come out with a statement to really address the fact that they haven't discouraged it, or not that they're not recommending it. It's just that they've got other priorities at the moment.
Yeah. So they're not saying it's a bad thing. They're just saying that they're looking at other areas that they need to try and get into. Yeah, good.
Correct.
This is a good question. So my child is turning 12 in a month. Should I just wait for them to get the adult dose?
Yeah, so the short answer is we want them to be vaccinated ASAP. And certainly the department have come out with a very clear guideline to say that if you are 11 years, 11 months now, book yourself in. And if you're under 12, we'd recommend the 10 microgram dose. And for the second dose, if you're now turning 12 or over 12, we'd recommend getting the 30 microgram or the adult dose. Based on the evidence we've got, is it's very effective, even though you're getting a smaller dose than a bigger dose, and we're purely basing it on the age.
Yeah, great. Might be a bit of a tricky one, but what should a parent do if the other parent refuses to vaccinate their child? Any suggestions on that one?
Yeah, it is a real, I guess, tricky conversation to have, isn't it? And it's part of parenting 101 about having parents to be on the same page as each other. I think it's important to have that discussion, and I think if there's any concerns or questions, then speak to your health professional, speak to your GP or your paediatrician or your maternal child health nurse, speak to the teachers and families and friends around you. It's a good conversation to have, and we welcome it because the children actually are really stoic and they'll take it really well, but I think it's important for the parents to be good role models and explain that to them.
Yeah, open communication and talk to your health advisor. Yeah,
absolutely.
Yeah. Good. How long do kids need to wait between first and second dose? It's 12 weeks, is that right?
No, so 8 weeks. So the recommendations have changed a bit, and this is where there's sort of been some discrepancies and discussions. But for the 5 to 11 cohort, it's 8 weeks. Now that might change depending on what happens with the surge and with schools opening up. In the US, they do it 3 weeks apart. But ATAGI, the data that ATAGI have looked at seems to point towards, at 8 weeks, it seems to potentially have longer lasting effect, which is why they've gone for that at this stage.
Great. And this one might be one of the most challenging parts of getting them vaccinated. So do children need to observe the 15-minute wait period that's necessary? I know getting them to sit there for 15 minutes can be a bit of a challenge, David.
You can, yeah. Well, yes, they do. They do need to have a period of observation, and 15 minutes is sort of the recommended time frame. In terms of making sure that they're safe post the vaccination, we just don't want any adverse outcomes, and that's why a lot of the centres are now so child friendly and bring along good distractions for them. You know, it's the one time that I'm okay with them having the iPhones and the iPads and everything, just to distract them for those 15 minutes, just to make sure they're okay.
Yeah, great. With the shortage of rats, where can I get my child tested?
Yeah, it is. You know, they're very hard to find at the moment. So they're on the Victorian website. There are centres where you can look for child-friendly or family-friendly sites to get PCR tested. You can do, if you can get your hands on a rat, there's the website that you can find a rat to try and find chemists and pharmacists locally that might be stocking or have it in stock or supply. But it would be through the testing centres at the moment.
I think rats have never been so popular, David.
That's right.
Okay, is this video going to remain on YouTube with questions? I think I can answer that. We will be having the link. We will leave it up for people who haven't been able to see it or want to see the whole thing or share it. So yes, it will be available to everyone. Just waiting for more questions. I think we might be, oh no, we've got another one popping up there. The US have the CDC. Does Australia have something similar? Maybe if you could explain what the CDC is, David, as well, that'd be great.
Yeah, that's the Centre for Disease, which is the governing body with public health messages, with looking at the data during pandemics and endemics and with infections like this. I mean, we do have very similar bodies here in Australia, and particularly regarding immunisations in particular, our ATAGI is the governing body that does most of the recommendations to the government about vaccines and safety and what would be best for the Australian public. There are certainly different bodies that look after infections and things like that here in Australia, but ATAGI is the one that we most would be referencing.
Yeah, great. Thank you. Just remind people, if they do want to put in some questions, just go to the www.menti.com and use the code 2359777. We still have around 10 minutes if anyone wants to just put those questions in. David's here to answer them. Just, if we don't have any more questions, we might even wrap it up, David. I'll just wait another minute or a few more seconds and see if another one pops up, or else, oh, there we go. When you wish they come. Are vitamins C, D, and zinc proven to reduce symptoms in people with COVID?
So there's no evidence that it's certainly, I mean, in terms of reducing symptoms, it's certainly not helpful in helping you recover in terms of removing the virus from you earlier or becoming asymptomatic. Certainly, pain relief, Panadol, Nurofen, some of the supplements that you've talked about there might make you feel better, but certainly getting rid of the virus or recovering from the virus per se is not been proven to be effective at all. I think that has been well and truly debunked.
Yeah, okay, great. Thanks, David. I think we might have come to the end of the question, so we might actually wrap it up there, David. So I would just like to thank everyone who's attended tonight and participated in the Q&A, and there were some great questions there, so really appreciate that people put those in and participated. So a really good discussion, and hopefully this valuable information has helped with any questions or concerns that you might have had. And I'd just like to really especially thank Dr. David Tran for your time tonight and your expertise on this topic. It's just been really valuable to have you here. So thank you again for making your time available for the community's questions.
Thanks, Tim.
And as mentioned earlier, we will have a recording of this presentation available on our website, the City of Whittlesea's website, so in the next few days. So please feel free to share it with your family or friends. And also a reminder that if we do have a dedicated friendly vaccination hub that we've spoken about at the council offices at 25 Ferris Boulevard, South Morang. So to book that, just go to the corona.vic.gov.au website. So thanks very much, everyone, and have a great night and stay safe.